My name is Matt Turner, and today I'd like to take a few minutes to discuss how chiropractic care can be an effective treatment for cervicogenic headaches. So, nearly half the population actually suffers from headaches or chronic headaches. There's several different types of headaches, all with their own unique presentations. You have your cluster, migraine, sinus headaches, cervicogenic headaches. Now, before we go any further, if you are experiencing sudden or severe onset, new or unfamiliar type of headache, loss of consciousness, numbness or tingling in your face and hands, difficulty swallowing, difficulty talking, difficulty walking, you seek emergency care now because your underlying condition might be severe. A cervicogenic headache, big word, so let's break it down. Cervico, meaning neck, and then you have genic, which means produced by, headache. Cervicogenic headache, which means headache produced by the neck. It's a mechanical problem. So mechanical problems usually require mechanical solutions. That's where chiropractic comes in play. A chemical solution would be taking pills and whatnot. That's not us, so we're not. A 2001 systematic review published by the Journal of Manipulative Physiological Therapeutics indicated that not only is a chiropractic adjustment more effective in treating cervicogenic headaches than other treatment modalities, but it appears to be comparable to the first-line prescription medications that are usually prescribed for tension or migraine headaches. What causes cervicogenic headache? Well, there's several different causes. Trauma, poor posture, chronic position you put yourself in. It could be a car accident, it could be sports accident, it could be your stressors. Your work, social life, personal life, family life, all these things has an effect on your body. The toxins you put into your body, whether it's medications or supplements or the type of food you eat, there's lots of different things that cause headaches, and there's lots of different things as chiropractors that we can address. I'll be talking about the effectiveness of the chiropractic adjustment. 2020 systematic review and meta-analysis published by the European Journal of Pain stated that a chiropractic adjustment provides small superior short-term benefits for pain, intensity, frequency, and disability for treatment of cervicogenic headaches. Okay, well, let's go over some of the symptoms of a cervicogenic headache that you might experience. Now, it's not a throbbing headache. It's going to be kind of a dull, deep, achy type of headache. And it's all going to start right around here in the base of your skull. This is called your suboccipital triangle right here, and there's usually going to be tender spots that you can touch and it's going to be sore. You're going to have an associated neck pain anywhere from up here in the upper cervical or upper neck all the way down through your neck, even into the upper back or your upper thoracics. Now basically you have your muscles, your trapezius muscles, your levator scapula, your scalenes, your suboccipital muscles. All these muscles, they start at different points and they all come up and they connect, and a lot of them insert right here at the base of the skull. So what causes a cervicogenic headache? Like, where does this come from? Well, normally the spinal segments, these things right here in your neck, they move freely and easily and they have full range of motion, and movements don't cause any pain. But in the case where one of these spinal segments misaligns, and chiropractors refer to this in a number of different ways. They can call it a subluxation, they can call it a spinal misalignment, they could call it fixation, they could call it segmental and somatic dysfunction. There's all sorts of different names for it. But basically, that's where we start, and we have a bunch of tools at our disposal to be able to determine exactly which segment is misaligned, and then we provide a very specific manual adjustment into that region, and puts the segment back into proper alignment. Therefore, it restores all normal function. Because when one of these segments is misaligned, it puts pressure on one of these nerve roots that actually come out in between each one of these segments. See? So if it misaligns, it puts pressure on it, on these nerves, and that reduces nervous system flow. You can kind of think of it like a garden hose. When you step on a garden hose, not that much water comes out. That's when that'd be the equivalent to a segment being misaligned. Your foot on the garden hose. You realign the segment, take the pressure off the garden hose or off the nerve root. It's like taking your foot off the garden hose. Full nervous system supply comes back. Therefore, restoring proper motion and reducing pain and stiffness, and therefore relieving the headache. Spine Journal published a randomized control trial that indicated that a combination of chiropractic adjustments and therapeutic exercises were beneficial for cervicogenic headache relief and maintenance thereof.